Yes, Dr. Lechu. First of all, hearty congratulations for
Thank
clearing
you.
of INI SS examination in cardiothoracic and vascular surgery.
Thank you.
Congrats, Lechu.
Thank
It's a
you, sir.
pleasure to have you with us today. And I think this conversation is going to throw more light on people to inspire more people to join cardiothoracic surgery and vascular surgery. And also
Yes.
you can guide them, and we'll take few points on how you went through this task, so that it will serve as a stepping stone for the future cardiothoracic surgeons.
Yes, sir.
Really introduce yourself, Dr. Lechu, where you got graduated and how you got inspired with cardiothoracic and vascular surgery.
Yes, sir. I'm from Tamil Nadu, sir. I did my UG and PG in Tamil Nadu. And regarding cardiac surgery exposure, I didn't have any exposure, sir. I had only 1 month posting in cardiac surgery, sir. So I don't have any previous exposure in cardiac surgery, sir.
Then how you developed passion? Uh, which kindled you to have interest in cardiac surgery?
Sir, anyway, I thought of I want to
You
start
want to
from
achieve something in the future, huh? So you got used up with the regular general surgery, so you want to do something new, and you want to achieve something.
thought of not competing with other general surgery cases, sir. So
So you want to be
if
unique.
other
So always
cardiac
heart,
neuro,
lung, and peripheral vascular diseases are very unique. Only CTVS surgeons can do such kind of surgeries.
yes, sir.
So it just reminds me the day when I decided on vascular surgery. My senior was telling me that I want to be a better general surgeon, and the thing which makes me more afraid is like to deal with the bleeding vessel. And to be a better surgeon, or to be even a better, or any specialty, you need to know how to tackle the blood vessels, how to handle them, how to control the bleeding and other things. So I think it's a unique field by itself, cardiothoracic and vascular surgery, because like no one else can replace the person, because like it's a special field, and it has been there for a very very long time, and it has undergone a lot of tremendous changes over the years. And I think it's gonna evolve and develop in future also. I think Tamil
Yes,
Nadu has the maximum number of cardiac transplants, sir. We have a maximum
Yes,
number of cardiac
really.
transplant happening
In from
across the
Chennai
India.
itself, we are doing around 15 to 20 cardiac transplants on an average. So cardiac transplant will become a separate subspecialty in future. And most of the cardiac surgeries are just entering into the minimal invasive cardiac surgeries, and thoracic surgeries are entering into VATS, video thoracic surgeries. So it is just transforming, and it is a very innovative field and upcoming field. So you should be first proud of to become a cardiothoracic and vascular surgeon.
thank you, sir.
So
Thank
how
you.
our notes has inspired you? How it helped you, Dr. Lechu?
First, I got to know about Dr. Tales by Rajamandran sir, because there is working in
Fantastic.
my Vilppuram Medical College, sir, where I did
Yes.
my PG. So through him, I purchased Dr. Tutorial, sir.
Okay.
And, by August, I purchased Dr. Tutorials, and for 2 months, I was reading for NEET SS, general surgery, and whole topic. I purchased only NEET SS plan, and I was
Hmm.
start reading. So when the initiate announcement came, I start preparing only for cardiac surgery. And I thought after the initiate, we'll continue preparation for NEET SS. So first, I completed one reading of general surgery. Then I read only cardiac notes for 3 to 4 times. I revised cardiac
Okay.
surgery notes and
So
all
you
the
read
previous
only
years.
our notes in doc tutorials. So that helped
Only
you, no?
sir, only doctor tells that to main is cardiac surgery notes, sir.
Yeah, actually we covered major topics and what are all the topics to be known before attending examination. That's very, very, very glad
Yes,
to
sir.
know that.
Yes,
Lucky you were exposed to Dr. Subbarayan and Dr. Saravanan in your vascular surgery departments in PG days. So you got to assist them
yes, sir.
during your vascular surgery cases and all.
Yes, sir. Sir will give initial access. They will give, sir. Uh, then also will give few steps they will give us, sir. Because we don't have
So
MCH
it,
PG there,
it,
so
it
sir will give us chances, sir.
so that was just a stepping stone to just a small sample to the big picture. The big picture
Yes,
is like what you are going to step into now. I think
yes,
like
sir.
there are, I mean, since this time there is only cardiothoracic seats and you have all the AIMS, Chitra, PJ, all will be open. But I think, uh, I think if you decide on the institution, I think it will be very good. Sir,
Yes,
you want to suggest something, or
Um,
do you have any questions that you regarding it?
yes, sir. Sir,
sir.
actually, many of our doc tutorials previous candidates have joined and has prioritized AIMS as first choice. And last 2 years, I think a few candidates have joined AIMS. And we also discussed in the discussion in the previous years. So my suggestion will be just read and train best institute. So our
Okay,
suggestion will be AIMS, and
okay,
next you can consider Chitra and PGA or JIPMER. So it is
okay,
our
sir.
preferences, and there will
Yes,
be a few wishes with you know. So since you are from South, so what is your plan?
sir. I'm looking for thoracic exposure, sir, but I don't know which institute will do more thoracic cases.
Thoracic means AIMS will be one of the good option. So you can have a privilege to go peripheral posting in Delhi itself.
Okay,
So there is a separate TB institute in Delhi. So you
yes, sir.
can get a peripheral posting there. In
Yes,
Chitra,
sir.
there will be predominantly cardiac work only. So thoracic may not be there. And in
Chitra,
Jipmer,
actually, the
there will
vascular
be giving.
surgery, the vascular division does the thoracic job, but it will be in the same OT. There will be like three OTs, will be cardiac OTs, and one OT will be vascular OT. So you can go and see, but there will be
Yes.
vascular surgery residents who will be there. So you will have
Okay,
I mean, it's not like full hands-on exposure, but you can have a bird's eye view there. But as Sir said, if you really want thoracic surgery, I think AIMS Delhi is a better option.
Definitely a good option.
okay, sir. Yes, sir.
There you can learn a lot. They are doing minimal invasive cardiac surgeries, and they are doing many aortic surgeries. So one of my friend
Okay.
who trained there, and he is in Chennai now. He's having good skills.
Yes.
So that is very important for your future. So spend 3 years
Okay.
and be there in there as an internship, as a consultant there for the next year, and just you can
Okay.
after that, after gaining good exposure with the cardiac and thoracic, you can come back here.
Yes, sir. Yes.
So what is your advice for people who are willing to pursue cardiothoracic surgery? Lechu, you wanna say a few words to the people who are, really want to take up cardiothoracic surgery? How was your exam? How was the preparation? What do you suggest them to do it? Like how to go about INISS for CTS?
So for CTS, may cardiac more than vascular. I think cardiac they are focused. I don't know about previous sessions, but this session they focus more on only cardiac parts.
Mm-hmm.
And the general question we can able to handle it by revising previous year questions, or we will have some one revision of general surgery, sir. But cardiac surgery they are more focusing more, sir. Around in 50 to 60 questions, mostly were cardiac surgery, sir.
Okay, can you
And
remember
one,
what are all the topics that has been focused for the examination? So it will be very useful for the candidates who are watching.
sir, from history they asked from starting it was our notes, sir. From history they asked one scientist name, sir. Then
Okay.
from anatomy, blood test, they asked named vessel, some artery of Kugel, some two, three
Okay.
arteries they asked.
Mm.
In that they asked. Then mostly from our notes, sir. In and around some our notes only, sir.
So every questions has been asked from our Dr. Dorel's notes. So we are very good, very glad to hear.
I have read only doctoral notes, sir. Previously also I had no exposure. After reading notes, from 4 to 5 times I have gone through the notes, sir.
This is
So that helps me to practice, sir.
that is a very, very glad to hear that. So
For
what
general
is
surgical questions, sorry, sir. For general surgical
yes,
questions,
in general surgery trauma, they asked 2 to 3 questions, sir. Clinic trauma regarding management, they asked, sir. And radiotherapy they asked, sir. But that was easy, able to handle that.
very nice lecture.
So what is your expectation in the future? So you are going to take a unique field, no? So what is your expectation? What is in your mind?
I want to learn about both cardiac, thoracic, and vascular.
So you
And
are going to
after
learn a new skill.
yes,
So
sir.
popular saying is you have to learn, you have to unlearn, and then you have to learn new things. So
Yes, sir.
that will be there in your entire career. So you are going to
Yes, sir.
learn new skills,
I want to
fine
practice the
skills.
batch.
Yeah. But it will be really passionate. So being a cardiothoracic surgeon, I know how passionate the field is, and it should be really proud of being a cardiothoracic surgeon.
Yes,
And really a good field, and it's an upcoming field. So I mean, as I told, minimal invasive VATS and transplantation, then aortic surgeries, and along with that, routine cardiac surgeries like CABG. Since CABGs we are
but
doing off pump in the recent days, then multivalvular heart surgeries, even valvular repair. Valve repair are coming out as a separate entity.
yes, sir.
And coming to the thoracic, you will be dealing with the tracheal surgeries. Then among the lung surgeries, even segmentectomy. Even we are doing segmentectomy apart from lobectomy and pneumonectomy. So lot are there. Even though the organ appears heart and lung, there are multiple techniques and multiple new surgeries you are going to learn in the future. And
Yes,
regarding
sir.
the vascular surgeries, Dr. Murali will explain. So
Yes.
vascular surgeries nowadays people are very less, right? Yes, sir.
I think like the main reason being people are like little afraid of doing long hours. It is actually that is what gives you a lot of goosebumps. That kind of adrenaline which is there when you do the work. No, that is what keeps you going. But some are like reluctant to do it. It really gives you goosebumps. It really initially probably 1 month or two you might find it little as I said to learn to unlearn and to learn. No, that's the most difficult part because you would have had some prefixed ideas in your general surgical period, but now that when you enter the specialty field, they will have a different kind of pretext and approach towards a certain problem. So you need to like unlearn certain things and learn certain things, and you might have to put some long hours, but you can choose how to work. And there are, as SARS has already pointed out, there are handful surgeons who are there. It's not like other specialties, no. There are only very few surgeons are there. But once you when you're doing your studies in a premier institution, as Sarah has already pointed out, be a registrar or be a junior consultant there for 1 or 2 more years, learn a lot of skills, ensure that you sharpen your knowledge before and skills before coming and settling down, so that you'll be a better surgeon in the future. And you will have to be prepared for what is going to come 10 years down the line. And vascular
Yes,
surgery, as Sarah has already pointed, there will be a lot of aortic surgeries, aneurysm surgeries, and we do a lot of evaluation, lot of occlusions, lot of occlusive surgeries. And I think vascular surgery got exposed during your undergraduate PG days as well. So nothing new or nothing it's totally like not something totally remote for you, but you will do a lot of work. Probably when you do CTVS, there will be like a lot of cardiac work, like comparatively lesser thoracic and vascular work, but you can choose to pursue however you wish to. Like you can be a adult cardiac surgeon. You can be a fetal cardiac congenital. You can be a pediatric cardiac surgeon. You can be a somebody who is a very specialized with minimally invasive thoracic surgery or tracheal surgeries. So you can specialize yourself. There are a lot of avenues in vascular. You can be an aortic surgeon. There are some surgeons who are well known for their aortic work alone. If you say their names, they just say that he's a very good aortic surgeon. Like Sarah has already pointed out, no, there are a few aortic surgeons in AIMS as well. They do a wonderful job. But if you say the name in the community, they will know, oh, he's one of the well-versed person in aortic surgery. So they are subspecialized themselves, and it is a very small fraternity. You will know almost every one of them. You may even know their names, who their family members are, kind of stuff. So it's a good feel. It's like a bigger family. Your work family now. So just be ready to slog a little bit. Initial days may be a little tough, but I think once you get over the initial 2-3 months, then it'll all be cakewalk. How fluent are you with Hindi?
That also I have to learn from scratch, sir.
Hindi தெரியாது போடா அப்படின்ற
Good. Quickly learn them.
Okay. That is not an issue.
And
Definitely.
who did me with me in PG? He also joined CTVS last year.
Okay, that's very good news.
Good.
There were 2 PGs in our unit, sir, and he joined CTVS last year in MMC.
Okay. You will learn
So
Hindi.
nice.
That
So nice.
won't be
A lot of
an
people from
obstacle.
Viluppuram and people from Tamil Nadu are joining cardiothoracic and vascular surgery. We're happy that we are able to, instill some
At
of
least,
the seeds there.
Very happy to see this. Okay, already there are many doctoral candidates are there in AIMS, so it's easy for you
Yes,
to
sir.
catch friends there, and
Yes, sir. Okay.
be in touch, and
Yes, sir.
definitely we'll be meeting somewhere in the conferences in the
Yes, sir.
future. Say hi to our
Yes, sir.
previous friends.
Yes, sir. Hi, all.
Do you want to say anything to the upcoming candidates?
I want to thank Dr. Pratt, sir. And I have read only those notes, and that helped me to give an interview now, sir. Without those notes, self preparation for me it is not possible, sir.
Okay, thank you.
Thank you, sir. Thank you.
Super,
Yes.
Lacho.
Okay.
Congratulations again.
Once again,
And,
congratulations.
Thank you.
And all the best for your career.
Thank you, sir. Thank you.
Very happy to
Best wishes, buddy.
seeing our students shine. All the best.
Thank you.
All the best, Pa.
Okay.
Thank you, sir.
Yeah. Thank you.